My name is Sandy Davis and I'm the Managing Better caseworker for Bridgend County Care and Repair. We received a referral to the Managing Better service by Maureen Griffiths, the Eye Clinic Liaison Officer for RNIB, who is based at the Princess of Wales Hospital Ophthalmology Department. The referral was for Mrs. Bickle, who is 85 years of age, retired and lives with her son who owns the property. Mrs. Bickle has always been a physically fit, active woman and walked an average of 4 miles a day. Her general health has always been very good, rarely visiting the GP. She has been diagnosed with age-related macular degeneration and cataracts. She is due to have emergency cataract surgery on both eyes and was certified as severely sight impaired. She is hard of hearing and has high cholesterol and blood pressure, which she is on medication for. I visited Mrs. Bickle to carry out an initial sensory impairment assessment and healthy homes check and identified the following issues. Mrs. Bickle wasn't in receipt of any benefits, unable to access her back garden safely, struggling to bath and shower safely in a well-lit environment, struggling to make a hot drink safely, use the microwave and general kitchen skills. She was burning herself on the gas cooker and nearly caused a house fire due to her sight loss and poor lighting, not able to read correspondence and see the TV, unable to hear the doorbell or TV, struggling to accept and cope with her sight and hearing loss, feelings of isolation, depression and low in mood. Following the assessment, I referred Mrs. Bickle to the RNIB Rights, Advice and Information Service for an assessment for attendance allowance. I accessed the Rapid Response Adaptation Programme with additional support from the local health board to put in place a handrail on the stairs so Mrs. Bickle could get up and down the stairs safely. I arranged for under-unit lighting in the kitchen so Mrs. Bickle could use the kitchen safely, as previously she was burning herself through overfilling the kettle and cups. I arranged for a grab rail and edgings on the back door step to be fitted, as Mrs. Bickle was falling when going outside to put her washing out. I then made a referral to the Community Resource Team for a Community Occupational Therapist assessment to assess for a level access shower and telecare assessment. I encouraged Mrs. Bickle to attend her audiology appointment, have her hearing assessed as she was very reluctant to attend. Once Mrs. Bickle has had cataract surgery, I will refer her to the Welsh Low Vision Service for a low vision assessment to assess for magnifiers and task lighting. Finally, I arranged a joint visit to see Mrs. Bickle with Kath Greenwood, who is the senior practitioner in Bridgend Social Services Sensory Team, to ensure that we are working in partnership and not duplicating services to provide the best possible outcomes for Mrs. Bickle. So what difference has the Managing Better service made to Mrs. Bickle? Mrs. Bickle has now been awarded the higher rate of attendance allowance, which has helped her to remain living independently in her own home. The handrail on the stairs, under-unit lighting in the kitchen, grab rail on the back door and edgings on the step have all been installed. Before the Managing Better assessment was carried out, Mrs. Bickle was at risk of tripping and falling in the house and outdoors, burning herself and becoming increasingly socially isolated and anxious. By working in partnership with health, social care and the third sector, we have been able to reduce the risks to Mrs. Bickle's personal safety. She is now able to maintain her independence and continue to live safely and happily in her own home, without the fear that she may be admitted to hospital through a serious fall or burns. Through working together, we have all helped Mrs. Bickle to manage better.